Hello dear learners, I hope you all are doing well. So let's get started today with a new session. As you know that I am taking tracts, so this is going to be the session where we will deal with spinocerebellar tracts. Okay, again ascending pathway. This is Dr. Reena's Physiology Core Integrated Conceptual, my Telegram group where you will be getting the notes in the form of PDF of whatever lectures I am taking. Now the lecture which initially was completed was on the dorsal column, fasciculus gracilis and cuneatus. This is going to be your spinocerebellar tract. Now just remember that the information that is going to the brain can be exteroceptive, that is originating from outside the body, pain, temperature, touch, and proprioceptive, that is originating from inside the body, that is from the muscles and from the joints. So what is proprioception? It is the awareness of the position of the joints, which is conscious and unconscious, which is also performed as a part of our general, as a part of a sensory examination. So when we teach you sensory examination, we are going to cover this in the clinical viva of CNS also. Now it is very important that this information should be carried all the way to the cortex and especially to your cerebellum, so that the cerebellum remains always aware about the position of the body, because it has got a very important role in coordination, in tone and in equilibrium, right? So cerebellum को ये सारी information मिलना बहुत ज़रूरी है, whether you are sitting and sleeping, lying down, whatever you are doing, it should have a knowledge. Another important thing is this is the cerebellum and this is your cortex. So the cortex is spending one copy, that is the corticospinal tract, which you also called as the pyramidal tract, which lodges on the alpha motor neuron, and it is going to supply the skeletal muscles which will perform the voluntary activity. So this plan of execution, a copy of this plan is also sent to the cerebellum. So cerebellum is aware from the cortex कि कौन सी activity होने वाली है. At the same time, these tracts, the various spinocerebellar tracts, they will give information about the periphery to the cerebellum. So the cerebellum is going to compare this movement or this plan with this outgoing activity. So what is the outgoing plan, what was the blueprint given, and what activity it is performing, what the body is performing, and agar if there is any disparity, then it is going to bring about the smoothening and the correction of the ongoing movement. So this is the importance of providing the information from the periphery to the cerebellum, so that there is smoothening of movements, there is coordination of the movements are performed in the way they were planned, apart from your equilibrium. Now suppose this comes again in the form of an LAQ, which could be enumerate the different ascending pathways and describe the pathway of unconscious proprioception. Now enumeration we have already done in the last lecture, so I will not repeat this. Now suppose it is proprioception. Now if it is given unconscious, it is very specific that I am going to write about the spinocerebellar pathways, right? But you can also add a point that there is also conscious proprioception, which is carried by the dorsal column, that is your fasciculus gracilis and cuneatus. ये भी आप add कर सकते हो to beautify your answer. So let's begin. So this is the spinocerebellar pathway, which are occupying this lateral position, and you can see that they are utmost lateral or utmost peripheral, even lateral to this anterolateral system. So that is the anterolateral system, which we will be covering on later with the pathophysiology of pain. So iske bhi lateral are your spinocerebellar tracts, which are posterior, that is dorsal, and this is anterior, that is ventral. So you have got two spinocerebellar tracts which are occupying the most peripheral part of the lateral white column. Now what are these spinocerebellar tracts carrying? They are carrying proprioceptive impulses which arise in the lower half of the body all the way to the cerebellum. Apart from this, some exteroceptive information like touch can also reach the cerebellum through these pathways, and we have seen that there are two types, ventral and dorsal. Now, since it is proprioception, if we speak about the receptors, which should be a part of your answer, receptors are your Golgi tendon organs, muscle spindle, and proprioceptive receptors like the joint receptors. Now, this is a very beautiful and a very easy diagram which I have found. So I think it's very good if you even are able to learn from this. So the the spinocerebellar tracts, this is going to be the first order neuron, that is the dorsal root ganglion, which is the only pseudo unipolar neuron. In terms, it has got two axons, one coming from the periphery and one going to the center. So all this, they are entering into the spinal cord through the dorsal root ganglion, which is the first order neuron. After entering, you can see, yes, so after entering, these fibers, they are going to end up here in the Clark's column of cells. Do you remember what are these Clark's column of cells, which I have taught you when I was teaching you the cross section of spinal cord? So these are specialized group of cells which are present towards the base of the dorsal horn. They are present towards the base of the dorsal horn, because towards the apex you have got the substantia gelatinosa of Rolando, which is important in the pain pathway. So whether it is your ventral or whether it is your dorsal spinocerebellar tracts, both of them are going to end here in the Clark's column. So this Clark's column is the first relay station of both the pathways, dorsal as well as spinal. Now remember dorsal DI, ये क्यों remember करेंगे DI? This dorsal is an ipsilateral pathway. It has got uncrossed fibers. So this is the dorsal spinocerebellar tract, which is occupying the most peripheral part. So it is going to ascend up all the way on the same side, going up to the level of the inferior cerebellar peduncle. So from this inferior cerebellar peduncle, it is going to make its entry in the vermis of the cerebellum. This vermis is the second relay station, from where the third order neurons are going to end up in the cerebellar cortex, in the anterior and the posterior cerebellar cortex. So DI, I से दो चीज आ रही है, I से ipsilateral मतलब same side uncrossed fibers, और I से आ रहा है inferior cerebellar peduncle. So the pathway is very simple. First order neurons, dorsal root ganglion. Second order neurons from the Clark's column, ending up all the way in the vermis, from where the third order neurons to the cerebellar cortex. Your ventral pathway, ventral spinocerebellar, you can see that some of the fibers are ipsilateral and some of the fibers are going contralateral. That means it is having both type of fibers, some of them which are uncrossed and some of them which are crossed. So from the Clark's column, some of them are going to go on the same side, some of them going to cross and go up. It is going to go all the way up. It is going to go all the way up to the midbrain, and it will be passing through the midbrain ka red nucleus. It will not be terminating or even halting in the red nucleus, right? So it is going to go all the way from the dorsal column. It is going to cross from the Clark's column all the way up in the lateral horn, lateral white column, or the lateral white column, and from वहाँ से ऊपर passing through the midbrain, that is the red nucleus, to the superior cerebellar peduncle. So it is making its entry again into the vermis, but through the superior cerebellar peduncle. So VS, S will be superior cerebellar peduncle and V is ventral, and DI is inferior cerebellar peduncle. Again from the vermis, the third order neurons, they are going to reach more towards the anterior cerebellar cortex. So these pathways are very simple, but normally we give more importance to our dorsal column and pain pathway, but there can be a question on the spinocerebellar tract. So I have made notes for you proper, you can just go through them. So the first order neurons of both the pathways are dorsal root ganglion. Axons of these cells after entering into the spinal cord will synapse with the Clark's column. From the Clark's column there will be origin of the second order neurons, and from here both the tracts, whether it is ventral or dorsal, will have same second order neurons. The fibers of the dorsal spinocerebellar tract, they will pass laterally, most peripheral, on the same side. See, it is ipsilateral, on the same side, occupying the most lateral and the most dorsal part of the lateral column. So even lateral to the anterolateral system, that is lateral to the pain pathway. The ventral spinocerebellar tract is consisting of both the crossed fibers as well as the uncrossed fibers, and lies ventral to the dorsal spinocerebellar tract, but also it is in the lateral white column. So they are occupying the lateral white column. Now the dorsal spinocerebellar tract consists of only uncrossed fibers, ascend to the medulla on the same side and pass through the inferior cerebellar peduncle. From the inferior cerebellar peduncle, they are going to reach the vermis of the cerebellum. From there, from this vermis, which is going to be their second relay station, the vermis is going to be their second relay station. The Clark's column was their first relay station. So you can write over here that the Clark's column was their first relay station, whereas the vermis is going to be their second relay station, from where the third order neurons will arise and they will going to terminate in the anterior and posterior cerebellar cortex. Whereas if you look on to the ventral spinocerebellar tract, which has got both crossed and uncrossed fibers, which lies ventral to the dorsal spinocerebellar tract in the lateral column. It ascends up to the midbrain, up to the level of red nucleus, but it is not going to terminate in the red nucleus. It is going to pass through the red nucleus and not relay there. It is going to enter the superior cerebellar peduncle to take entry into the vermis. This vermis again is going to be their second relay station. So second relay station, first relay station is common, from where the third order neurons, they basically terminate into the anterior cerebellar cortex. So remember, dorsal is ipsilateral, ventral is having both crossed and uncrossed fibers. Dorsal is entering into the cerebellum via the inferior cerebellar peduncle, but the ventral is entering into the cerebellum via the superior cerebellar peduncle. This is the important difference between the two. Both of them are involved in the regulation of posture, tone, muscle tone and coordinated skill movements. And if there is a lesion of this tract, the patient develops what is called as sensory ataxia. That means closing the eyes, the person will sway. That is what is ataxia. There is also motor ataxia, and to differentiate sensory ataxia from motor ataxia, there is a sign which is called as Romberg sign. The person is made to stand and then close his eyes, and you visualize whether he is going to sway with eyes open or with eyes closed. So that is the Romberg sign, which is used to differentiate between sensory ataxia, motor ataxia, which is very important for your Viva question. So this is all for the session. Hope you understood. Thank you all.